When you decided to study psychology, what did you imagine your life would look like by now? Maybe you saw yourself helping people transform their lives, financial stability for you, respect and a meaningful work. And where are you actually? Working in a school for 30,000 a month with a master's degree, doing HR work, administrative work that has nothing to do with therapy, sitting in an empty clinic wondering where the clients are. Some individuals may feel bad or directionless about choosing this field. I know this story because I have met hundreds of psychologists living it right now. Talented people, educated people, but somewhere between your degree and your career, something went wrong. My name is Alok. 9 years ago, I was exactly where you are today. I run the marriage suite, where we have saved over 8,000 marriages. Our therapist charges 3,000 to 5,800 per session. Clients book 4 days in advance. I have trained many psychologists who transformed from struggling to thriving in 18 to 24 months. It happened because they specialized in couples therapy. In the next 30 minutes, I'll show you why this is the smartest career move you can make and how it completely changes your professional life. Let's talk about what nobody told you in college. Your psychology professor said psychology was growing. They said there was demand. They said you'd help people and make a good living. What they didn't tell you, most psychology graduates earn 25,000 to 30,000 per month. That's less than a delivery driver even after having a master's degree. They don't tell you that counselor positions often mean administrative work, organizing events, and possibly talking to a few students about exam stress. They don't tell you that if you open a private practice, you'll sit in an empty room paying rent, wondering why clients aren't coming. 5 years after graduation, you are at family functions explaining why you are still not settled, while your friends with other subjects discuss promotions and foreign trips. Here is the question many of you ask. Did I waste 5-7 years studying psychology that can't pay my bills, or do you doubt that there is no scope to practice therapy in India? It's not your fault. You have the education, you have the passion. The problem is that your degree taught you psychology, but not how to build a psychology career in India. Let me tell you our failure story. In 2022, we needed 24 therapists to open 8 branches in Bangalore. We interviewed 2,094 psychology professionals, but we hired only 2 people, not because they were not educated. Most had MA, MSc in psychology, even MPhil and PhD degrees in psychology. They knew their theories very well, but when we gave them a real couple case like infidelity, controlling mother-in-law, communication breakdown, they had no idea what to actually do. They couldn't create a proper intervention plan. And here is the critical part. This is not their fault. How many Indian universities offered couple therapy specialization until recently? 0. You spend 5 to 7 years learning research methodology, abnormal psychology, individual counseling, but exactly nothing about the specialization with the highest demand, best income and fastest career growth in India. That gap is costing you your career. You are stuck because you are a generalist competing in a specialist world. When someone has chest pain, do they see a general physician or a cardiologist? When someone needs surgery, an MBBS or specialist, specialists earn 3 to 5 times more, not because they work harder, because they have rare, valuable skills. Right now, you are a general counselor. You help with stress, anxiety, relationships, career, self-esteem, everything. That's why you are struggling. When you do everything, clients see you as doing nothing really well or great. When someone's marriage is falling, they don't want a general counselor who also does relationship counseling. They want a couple therapy specialist, and there are almost none in India. After COVID, relationship issues exploded. Couples spent months locked down, old conflicts become unbearable. Infidelity increased. Google searches for marriage counseling in India are off 340 since 2022. But here is the crisis. Less than 500 qualified couple therapists in the entire country. 1.4 billion people, lakhs of couples in crisis. At the marriage suite, clients book 4 days in advance. I have 7-day waiting list. Every qualified couple therapist I know is drowning in demand, while thousands of general counselors compete for 500 per sessions. Almost no couple therapist compete for 3,000 sessions. Demand is massive, competition is zero. Income potential is 5 to 6 times higher. but only with actual expertise, not weekend certificates. General counselor charges 500 to 1,200 per session, maybe 5 to 8 clients a month. Most come for 3 to 4 sessions, monthly income 20,000 to 35,000, inconsistent income, constant anxiety about the next few clients. Couple therapy specialist charges 2,000 to 5,000 per session, but couple therapy is long term. Average couple stays 6 to 18 months. That's 24 to 72 sessions. One couple at 3,000 per session, bi-weekly for 12 months, 72,000 from one couple. And couples refer constantly. Save someone's marriage, they tell 5 friends. With 8 to 12 ongoing couples, 80,000 to 2.5 lakh per month. That's the scope. Consistently. Why such a difference? You are solving a crisis, solving marriages, preventing divorces. That has enormous value, but only if you actually know what you are doing. Only if you can create interventions plans, handle complex dynamics, work with attachment wounds. Weekend workshops don't work. Clients figure out in 3 to 4 sessions that you don't really know how to help relationship dynamic issues. They stop coming, they don't give you feedback too, and no referrals. Real expertise means long-term clients, continuous referrals, and premium income. Couple therapy does not just help private practice, it opens doors you don't know exist. Large companies have employee assistant programs, EAP, paying 80,000 to 1.5 lakh monthly. International schools pay 60,000 to 1.5 lakh. Indian therapists now work with US, Canada, UK couples, earning 1,65,000 to 4 lakh monthly. But here is what I recommend: the hybrid model. Keep your day job at 60,000 to 70,000 per stability. In evening and weekends, see 8 to 10 sessions weekly at 2,000. That's another 64 to 80,000. Total 1,30,000 to 1,50,000 within 2 to 3 years. Achievable? Absolutely, but only with genuine expertise and planning. Your psychology degree taught individual therapy. The message: regulate emotions, set boundaries, put yourself first. If unhappy, leave the relationship. Good for individuals, doesn't work with couples, often makes things worse. Example: wife says, my husband never talks to me. I feel alone. Individual therapist: you deserve better. Set boundaries. Maybe this is not healthy. Same couple in couple therapy. Wife says, he never talks to me. Husband secretizes everything. Nothing I do is good enough, so I stopped trying. Both are right, both hurting, both trapped in pursuit withdrawal cycle, neither created intentionally. Wife pursues because she feels abandoned. Husband withdraws because he feels attacked. Her pursuits makes him withdraw more. His withdrawal makes her pursue harder. This is the pattern. Your training didn't teach you to see it, name it, or interrupt it. That's why those 2,092 candidates couldn't help. Not because they were not smart, because they were not trained. In case of infidelity, general counselor says, this is betrayal. Decide if you want to continue this marriage or not. Couple therapist says, let's understand what created this. Let's process the trauma, let's rebuild the trust, let's rekindle the intimacy. And research says 60 to 75% who received proper infidelity recovery therapy report relationship became stronger, better than before. In case of communication, general counselor says communicate better, use I statements, calmly say it, all that, and doesn't work. A couple therapist identifies the pattern. You are in a pursue withdraw cycle. Wife, your attachment activates, you pursue. Husband, you feel criticized or blamed, you withdraw. Neither is wrong, you are reacting from attachment wounds. Then teaches how to exit this pattern. Emotional focus therapy. Research shows 70 to 75% recovery rates. But in case of family enmeshment, this is huge in India. Wife says my husband is controlled by his mother. General counselor, that's unhealthy enmeshment. You need to set boundaries. That always backfires and damages the relationship even more. Couple therapists understand cultural context. This is loyalty bind. He's caught between mother and wife, feels guilt. Either way, let's help him create a healthy differentiation without shame. General counseling gives surface advice. Couple therapy addresses root patterns with cultural sensitivity. That's why clients stay, get results, pay well, and refer others. Many weekend workshops promise to make you a certified therapist in 3 to 7 days. You spend 1,000 or 10,000, learn about attachment, communication techniques, and new interventions. Get certificates. Feel excited. Then a couple walks in. Husband had an affair, wife is devastated, rageful, both yelling, escalating. You freeze. You are supposed to create safety but don't know how you can feel safe there. You say something generic, communicate better, take a break. They come 2 to 3 more sessions, nothing improves, they stop. No referrals, back to struggling. Certificate on wall doesn't help because clients figure out in 4 sessions you don't actually know how to help them. Why quick certifications fail? They give concepts, not competence. Couple therapy is the most complex psychotherapy. Even Freud tried once, felt overwhelmed, and never did it again. You are managing 2 people's attachment wounds simultaneously at the same time, holding competing narratives, handling life conflict, navigating cultural pressures, family systems, and power dynamics. You can't learn this in 3 days. Remember 3 Idiots, the movie. Chase excellence, success will follow. Quick certifications chase success without excellence. It doesn't work. What actually works? Deep comprehensive training builds genuine competence. Our couple therapy training and certification program is a 6-month intensive program that needs 30 to 60 minutes daily commitment. 10 modules, 82 chapters, covering every aspect from foundation to advanced clinical work. 220 plus hours learning content, video, audio, and detailed notes. 30 plus hours of live mentorship with senior most couple therapists at the marriage fit, seeing couples daily, not academics, teachings theory. 1,200 plus real Indian cases analyzed, showing how attachment wounds present, how communication breaks down, and how investment shows up. Supervised practice. Work with real couples under expert guidance. This is where you go from I understand to I can actually do this. Peer learning groups, your professional network for life, career development, build practice, optimize online presence, and land EAP positions. Lifetime access after CTTC. You create intervention plans with confidence. Assess dynamics quickly, handle complex cases, not another certificate. Career-changing expertise is this. Let me introduce Marriage Fit to you. The Marriage Fit is India's most reputed marriage counseling clinic, started in 2017 and work exclusively with couples. We have saved 8,000 plus marriages. 3 branches we have now in Bangalore, 12 plus full-time therapists working with us. Clients book 4 days in advance. We charge 3,000 to 5,800 with 98% satisfaction rate. Every day, our therapists handle couples with affairs, abuse, investment, communication breakdown, and financial conflicts. When we couldn't find qualified therapists despite 2,094 interviews, we had 2 choices: lower standards of therapy or create our own training modules. We prioritized excellence. Over the course of 2 years, 6 therapists tirelessly worked and developed the couple therapy course. By analyzing 1,200 real couples cases to study and to apply appropriate interventions, all while creating a curriculum specifically tailored for Indian couples. Initially, the couple therapy training certification was offered internally only with a job guarantee. In December 2024, over 500 applicants registered for the course and we selected 26 participants. 5 therapists have already joined us at our HSR and Mathikar branches in Bangalore, and they are now working at the management. The rest will be joining us soon after completing the course. The other psychologists who couldn't join the first batch asked us, can we join just to learn? We realized we solved our hiring problem, but the industry training gap existed. We know the demand in India is so huge, we can't cater to all couples, even in the next 5 or 10 years. So we opened CTTC to all qualified psychologists, genuinely wanting to master couple therapy. We are not building a training empire. The Marriage Fit is a therapy clinic first. We created CTTC because couples desperately need help, psychologists deserve proper training, and our field needs to move beyond quick certifications. Here is your path and a realistic expectation you should have. There is no quick success in this field. Months 1 to 6, complete your CTTC program. Build a foundation, not earning from couple therapy yet, but investing in expertise. Months 7 to 12, see first 2 to 3 couples at 1,000 to 1,500. Build confidence and testimonials. Months 13 to 18, expand to 5 to 8 sessions weekly at 1,500 to 2,000 referrals starting. Months 19 to 24, premium rates 2,500 to 3,000, 8 to 12 ongoing couples. Reputation established, recommended models. Do not quit your job Continue trying until you secure a stable job with a monthly salary of 60 to 70,000. At the same time, build an evening or weekend practice with 8 to 10 sessions per week at 2,000 per session, which could provide an additional income of 64,000 to 80,000. Your target and goal should be to earn 1,24,000 to 1,60,000 monthly within 2 to 3 years. Long term, 2 to 3 lakh monthly, working 15 to 20 hours weekly, but only works with genuine expertise. If couples get results and refer friends, if therapists refer cases because you are an expert in couple therapy, you can deliver results. I want to repeat this once again for you. This is the perfect time for you right now. Post-COVID relationship issues skyrocketed. Couples seeking help, stigma reducing, but almost zero qualified couple therapists professionals. Every competent therapist is booked with waiting list or increasing their session fees. Complete CTTC and we will help you to position yourself properly and you become the couple therapist in your area by default. Barely any competition now, but this won't last. We are training 2,000 therapists in the coming 3 years. In the next 3 years, these 2,000 plus trained therapists will build their referral network, reputations and client base. If you are not joining now, it will be very tough for you in the future. Think YouTube. Those early creators with just decent content got views and subscribers very easily. Today, it is brutal. 0.001% success rate for new YouTubers. Couple therapy in India is at early YouTube stage. Door wide open, demand enormous, competition minimum. But won't stay that way. Start now. It is less competition now. Build faster. Higher income sooner. This is your early adapter advantage, your window. Enroll if you have at least a psychology degree, MA, MSc, preferred, or have done any mental health related study like MSW, Master of Social Work. This is for you if you want to build a financially successful career for you. Enroll if you want to practice real therapy as a career. Respected, well paid, genuinely helping people. Enroll in this course if you can commit 30 to 60 minutes daily for 6 months. Please note that this course is designed for working professionals. We have created podcast-based study materials so you can learn while multitasking, such as walking, traveling, or cooking. Enroll if you value genuine expertise over quick certificates. Enroll if you want to genuinely help couples, save marriages, keep families together, prevent divorce trauma, both for couples and children. This is not for those who want quick success or shortcuts. Don't enroll if you just want another certificate. We only want people who are committed professionals, genuinely wanting excellence, because couple therapy is sacred work. You are holding marriages in your hands, affecting entire families, children's future. This requires excellence. Let me be a little harsh and tell you the truth here. You have two paths from this moment. First path, do nothing. Close this video, tell yourself, I'll do it later. I don't have time right now. I don't have the money. I can't be a private practitioner. I don't know anything about it. How can I do it all by myself? Then return to your current situation and continue to struggle or hope that something will change and everything will be fine. Or path 2, enroll in CTTC today, commit 30 to 60 minutes daily, 6 months focused learning, build genuine expertise, 6 months later, start seeing couples. Creating intervention plans confidently, getting results. In 1 year, start seeing 5 to 8 couples, build referrals network slowly, 2 years, 2,000 to 3,000 sessions, 10 to 12 couples a month, 1 lakh monthly earning capability. 3 years, couple therapy expert in your area. Establish yourself and try to earn 2 to 3 lakh monthly, 15 to 20 hours weekly working with respect and fulfillment and impact. The same 3 years pass either way. The only difference is what you choose to do. One choice keeps you stuck, another transforms your career and life. What will you choose? I want you to choose a path where you take the lead, you create your destiny. No matter what decision you make at this moment, I encourage you to take a look at the couple therapy training and certification program to see what we have developed over the past 2 years. I have created a detailed overview video of the CTTC program that lasts about 10 minutes. Please take the time and to watch it. I'll walk you through complete curriculum, all 10 modules, 82 chapters. So you learning, format, explain, time commitment, introduce live mentorship, give complete transparency about course fee and how to join. We'll show you real success stories from CTTC graduates who transformed their careers. I don't want you to enroll without understanding exactly what you are getting. This is a significant commitment. I want to give 100% transparency so you can take an informed decision. Watch the program overview video, see complete curriculum, understand the structure, hear from graduates, then decide if CTTC is right for you. Find the link below and watch it now. Thank you for joining me and staying with me till the end. Now you understand why couple therapy specialization is the breakthrough opportunity. Please click the below link and watch detailed program overview video. Get all the information about the program, including the cost. Know this is building expertise that will change your career and life as a therapist. Once again, thank you for your time. Thank you for caring about excellence and couple therapy. I genuinely hope to see you inside the program. Thank you. Welcome back. You have seen why couple therapy specialization transforms psychology careers in India. You understand the opportunity, the income potential, the demand. Now you are asking, what exactly is inside CTTC? What will I learn? How does it work? Is this worth my investment? In the next 10 minutes, I'll show you exactly what you get, how the program works, and why this builds a genuine expertise, not just another certificate. Let's dive in. Let's discuss the investment first. The total cost for the complete program was 24,900, but we have made it 10,900 only. And also you have the option to pay through monthly installments of 2,000 for 6 months. We have set the course fee at a very nominal minimum rate, considering that many of you may be struggling to earn a good income in your current jobs. Or some of you may not have a proper job and are looking to start a career in this. For those who are already doing well in their careers and wish to enhance their therapy skills, this investment should remain manageable. We don't want anyone to stop learning and improving their skills simply because of financial constraints. Here is what you get: 6 months of intensive case study based, practical based, proven learning with 220 plus hours of learning content across video, audio and detailed notes, 30 plus hours of live mentorship with senior most couple therapists, peer learning groups that become your professional network of life, complete career development guidance. Once again, complete career development guidance, top 10 students getting supervised practice with real couples, feature on our website as expert couple therapist. This is for all participants who are completing the course. All content, future upskilling programs and annual masterclasses also is included in this. This is not buying a course. This is not buying a course. You are investing in a career that earns 1 lakh at least monthly in the next 2 to 3 years. Let me tell you what exactly inside the program. CTTC is a 6-month intensive program requiring 30 to 60 minutes daily. Let me be clear, this is not whenever you have time, you'll do it, you learn it. It's daily structured learning. Why? Because couple therapy is complex. You are learning to handle two people's attachment wounds, competitive narratives, handling life conflicts, cultural pressures, family systems, power dynamics, trauma theories. Let me make it very, very clear. This program is designed for working professionals. You don't have to quit your job. Here is how it works: self-paced core learning, video lessons you watch on your schedule, podcast style audio for multitasking or while commuting, color coded detailed notes for quick revision, live discussions, all doubt clearing sessions during lunch hours, peer group discussions in the late evenings. Everything is structured so you can complete these while maintaining your current work. And you get lifetime access, all course content, future updates, graduate community and annual masterclasses. You will be featured in our website with your profile as an expert couple therapist. This is not 6 months course and then goodbye. It is ongoing professional development for life. Support to establish a career that is fulfilling both financially and passionately. Let me walk you through what you actually learn in each module. Module 1 is your foundation, the therapist's role, common issues, relationship dynamics, individual versus couple therapy differences, ethics, boundaries, modern relationships including LGBTQ plus couples, cultural factors, building safety and the marriage fits proven assessment framework. Module 2, evidence-based theories that actually work all over the world. Attachment theory, emotionally focused therapy with 70-75% success rates. Gottman method backed by 40 years of research. CBT and behavioral couples therapy. You learn when to use which approach and how to adapt for Indian couples. These are 6 chapters and 6 evidence-based couple therapy. Module 3, this is where most therapists fail. Assessment and intervention planning. The critical skill of knowing what to do when couples present with specific issues. Initial assessment, identifying patterns, using assessment tools and safety evaluation. It has 7 chapters. Module 4, communication and conflict resolution, skills you will use in every single session. This module trains therapists in decoding and restructuring communication patterns that keep couples stuck in conflict. Special focus is given to Indian family communication styles, unspoken gender scripts, loyalty blinds, enmeshment with parents, and power dynamics between partners. Trainees learn emotional regulation strategies and practical methods to transform criticism, defensiveness, and blame into assertive, needs-based communication that promotes clarity and connection. It has 10 chapters. Module 5, working with emotions, the language of attachment. Emotions are the gateway to lasting change in couple therapy. This module teaches therapists how to identify emotions as signals of unmet attachment needs, read emotional cues beneath surface behavior, and work with family of origin imprints. Trainees learn attachment-based interventions to create emotional safety, deepen intimacy, including sexual intimacy, that guides couples through rupture and repair cycles with precision and empathy. It has 11 chapters. Module 6, cultural sensitivity in couple therapy, a critical module for Indian therapists. This module explores how Indian family systems, hierarchy, gender expectations, and social norms shape couple dynamics. Often unconsciously, trainees learn to work effectively with intercaste, interreligious, and LGBTQ plus couples while navigating loyalty conflicts. Ethical decision making is emphasized, helping therapists balance clinical integrity with cultural respect without colliding with harmful norms. This has 5 chapters. Module 7, specific therapeutic techniques and protocols. This module focuses on core evidence-based couple therapy interventions with clear step-by-step application. Trainees learn attachment-based bonding exercises, structured communication frameworks, forgiveness and repair process, and healing rituals for emotional connection. Each technique is taught with clinical demonstrations, common therapist mistakes, resistance patterns, and cultural adaptations relevant to Indian and diverse family systems, ensuring techniques are both effective and context sensitive. Module 8, managing the therapy process. Designed to build the therapist clinical leadership, this module covers goal formulation, session structuring, progress tracking, and outcome measurement. Trainees learn how to manage ruptures, setbacks, stalled therapy, and high conflict phases without losing therapeutic alliance. Ethical decision making, referral criteria, and planned health determination of therapy are emphasized, along with the meta skills that distinguish competent therapists from effective ones. Module 9, therapist self-care and professional sustainability. This module addresses the often neglected reality of therapeutic work. Trainees learn practical strategies to prevent burnout, manage emotional overload, and process trauma from intense couple cases. Emphasis is placed on boundaries, reflective practices, supervision, and personal regulation, helping therapists build a long-term emotionally sustainable career without compassion fatigue. Last, module 10, psychosexual dynamics and advanced specialization, an in-depth introduction to sexual health and intimacy within marriage. This module covers desire discrepancies, sexual dysfunctions, trauma-informed sex therapy, and intimacy rebuilding after conflict or betrayal. Trainees are trained to work confidently with diverse populations, belief systems, and relationship structures. Clinical protocols are shared to ethically and effectively integrate psychosexual work into couple therapy practice. Here is what makes CTTC completely different from weekend workshops and other programs. We analyzed and used over 1,200 real couple therapy cases in this program for you to study in this course. Every chapter includes at least 8 to 12 real couple case examples showing exactly how issues present in the therapy room, what is the couple actually says, what's happening beneath the surface, what interventions work and why, what mistakes to avoid. This is not hypothetical. These are real cases involving Indian couples, including issues such as infidelity, conflicts with in-laws, communication breakdowns, sexual problems, financial stress, parenting disagreements, and enmeshment patterns. If you are concerned about client privacy, please note all names and personal information have been changed for confidentiality. So there is no need to worry. You see how attachment wounds actually show up, how pursuit withdrawal cycles actually sound, how cultural conditioning influences emotional expression. By the time you complete CTTC, you have studied 1,200 plus couple cases. You have seen almost every pattern that can walk into your therapy room. That's why CTTC graduates can create interventions plans with confidence. You get 3 complete learning formats because people learn differently. Videos based study, 100 plus hours of professionally created video content, real Indian case studies with cultural context. Watch at your own space. Pause and rewind as needed. AI optimized videos for better clarity and experience. Then audio based learning, 120 plus hours of podcast style content for busy people. Learn while commuting to work, exercising, and doing household chores. Engaging conversational style, you will not feel like learning. For readers, we have beautifully designed documents with graphics, color coding, visual aids, and case examples embedded throughout. Perfect for quick revision before sessions. 220 plus hours of total content. Use whichever format works for you. Many graduates use all 3: videos for deep learning, audio for reinforcement, and notes for quick references. This is designed for busy professionals. Every minute of your day becomes potential learning time. CTTC is not just recorded videos you watch alone. Live mentorship, 30 plus hours of monthly sessions with senior couple therapists from the marriage pit who see the couples every single day. Real-time doubt clearing, case resolution, case consultation for complex situations, interactive discussions, not one-way lecture. Peer learning groups. You are placed in a small batches of fellow psychologists going through the program together. Collaborative case discussions, role play practices, mutual support and accountability. This becomes your professional network for years. Career development. This sets CTTC apart. We don't just teach clinical skills, we guide your career. Resume buildings for couple therapy roles, LinkedIn and practice optimization, social media content strategies, interview preparation for EAP programs, starting and scaling your own practice, pricing strategies, client acquisition strategies, everything required for you to build and sustain a successful career. Who should join this program? This is not for those looking for quick success, shortcuts, or overnight results. Therapy doesn't work that way. And neither does mastery. This is for real professionals, those who are really ready to study, deeply practice rigorously, and grow honestly as therapists. This is for those who feel a calling to help couples and families before the break, not after they are emotionally destroyed. For those who want to sit in the room when it's hard, messy, emotional, and still hold clarity, structure, and compassion. This is for those who want to take pride in calling themselves a therapist, not as a label, but as a responsibility, a craft, a lifelong discipline. This is for those who understand one truth clearly. Therapy is not social service. Therapy is a profession that deserves skill, respect, boundaries, and fair financial compensation. This is for those who want to build a financially independent and deeply fulfilling life, doing work that actually matters without burnout, guilt, or undercharging their worth. This is for those willing to invest in themselves, their education, their growth, their emotional capacity. For those who believe in themselves even before the world fully does. This is for action takers, not observers, not wishers, not one-day thinkers. This is for those who want to create their own destiny instead of waiting for permission. For those who are brave enough to choose growth over comfort, mastery over mediocrity, and impact over excuses. If this made you pause, if this felt personal, if something inside you said, "This is me," then you already know this program is for you. Here is how to enroll. Step 1, click the payment button. Choose your preferred payment method and option. Make the full payment or choose EMI option. Step 2, once you pay the course fee, you can get the complete program access within 24 hours and join your peer learning group. The current batch is enrolling now with limited seats. We maintain limited seats per batch for quality mentorship and peer interaction. When batch fills, enrollment closes until next batch. Don't wait, join now, start early, and stay ahead. This is couple therapy training and certification program by the Marriage Pit. 10 in-depth modules, 82 structured chapters, 220 plus hours of deep applied training, 1,200 plus real life case studies, life mentorship, complete career development guidance, not just theory, practice, clarity, and directions. You don't just learn couple therapy, you become a specialized couple therapist. You'll be featured on our website, presenting yourself to the world with credibility, confidence, and a clear professional identity. This is where you start building an identity, a fulfilling career, and a legacy. One course, 3 outcomes: competence, confidence, and career transformation. Across India, couples are silently struggling. from 25-year-olds confused about marriage to 45-year-olds facing middle life crisis, emotional distance, and disconnection. They are desperate for qualified, structured, ethical help. The demand is real. The opportunity is massive. And right now, the door is wide open. You can become the go-to therapist they trust when their marriage is at stake. I look forward to guiding you on this journey. Trust me, this one decision will change your career and your life. You will thank yourself for doing it. I'll see you in the program.